So it seems everybody's on these weight loss shots, Ozempic, Wegovy, Mounjaro, which are also used to treat diabetes, a couple of them. How do you know if these medications are appropriate for you? We're going to talk about some of the benefits and disadvantages of these medications. These medications have been around now for several years. Some of them have been branded under a new name, and there's some new ones coming to market. They are under a GLP1 GIP class, and they work on helping patients lose weight. So what are the advantages? The advantages are they are once a week injection, which is easy to tolerate for most patients. Forgetting to take pills is always something that patients complain about. This way, once a week shot, and they're done. The other advantage is they are a great tool to help patients reach their goals by reducing appetite and make any lifestyle change, dietary change, easier to follow. Thirdly, they increase metabolism. So while you're less hungry, you're also having a higher metabolic rate. And therefore, you're likely to be burning some fat and losing weight. What are the disadvantages? So these medications, with the large use of patients in the US and across the world, we are seeing significant side effects. The ones we know about are mostly the GI. They've been described from the very beginning and are known, which are nausea, vomiting, diarrhea, constipation. These are most common. In some patients, they're temporary and they go away. In some patients, they are barring them from using the drugs. They can't even tolerate the lowest doses or increase the doses to a good therapeutic effect to allow them to lose weight. So this is something that I warn patients about when they're starting these medications, that these are the side effects that are most common and to be aware of. Also in the GI side effect profile would be pancreatitis. So what is pancreatitis? Pancreatitis is an inflammation of the pancreas. It can be caused by various reasons and causes, most commonly in the non-weight loss world due to gallstones or alcohol. In the population that I treat, most common cause would be from rapid weight loss. That can happen with any weight loss regimen. It can happen after a gastric sleeve or a gastric bypass, after a patient gains weight for pregnancy and then, of course, loses the weight. We see it in that group, but also see it in patients who take a medication for the first time. It can happen when taking this class of medication. The GLP1 GIP, like the Ozempic, Wegovy, Mounjaro, can have a higher, slightly increased risk, 9 times than the average risk to develop pancreatitis, which is manifested by pain in the mid-back or from the upper abdomen to the mid-back, severe pain, piercing pain as if you're being stabbed, as well as nausea, just feeling lousy, sometimes fever, could have diarrhea, vomiting, and intolerance to food. We do warn patients about potential side effect when starting this medication. Another disadvantage of using these medications, especially if not closely watched with body composition, is significant muscle mass loss. We see this in both men and women. It could be extremely serious, especially in perimenopausal, menopausal women who are already at risk for bone loss. So think of the muscles and the bones as one unit. When you lose muscle mass, you will also lose bone mass. And oftentimes, you will lose that mass, and it's very difficult. As women age, to rebuild muscle mass is much more difficult as we're getting older, in both men and women. So the risk of osteoporosis is greatly increased. Also think about other muscles in the body, the bladder, the heart. Anytime there's rapid muscle loss, other organs can be affected. So we always want to make sure that we're losing unhealthy weight, not healthy muscle weight. That's more side effects. They're not as common, but should be mentioned. Mood changes. Anytime somebody's starting a weight loss regimen, this can happen just because we're adjusting to a new lifestyle. However, with this class of medication, potentially due to their effect on the brain, there is an increased risk for depression and slightly increased risk for suicidality, which should be discussed with patients when deciding whether or not to start this medication. If any mood changes should occur, somebody should stop this medication right away. Also, we have seen now, and it's been mentioned in the medical literature, the risk of gastroparesis, which means stomach is no longer emptying the way it's supposed to. And this can be something that we see with use of the injections. In fact, now when we're considering prepping patients for colonoscopies, the medication should probably be discontinued longer because we're seeing incomplete preparation of the colon pre-procedure due to delay in emptying of the GI system caused by these medications. I even discussed the risk of anesthesia with patients and make sure patients are off the medications and the surgeon is aware that they're taking these medications, even if they're getting them from a medical spa that are not, strictly scrutinized. Any type of this class of medication, even from a spa, not from a regular pharmacy, would also cause potential risks when undergoing surgery, as the surgeon expects your stomach to be empty. And if there's a delay in stomach emptying caused by this medication, you could potentially vomit during surgery, and that could be deadly. When stomach contents can go into the lungs while you're lying down, could be a very serious condition. So these are some of the disadvantages. It is a very effective medication class in many of my patients. However, you have to look at how much weight is needed to be lost. Is the side effect profile worth the risk? How long is the patient going to be on this medication? Can he or she be on a different medication afterwards? This is really a discussion that needs to be held by the physician and the patient to make sure the best care is given to the patient. So hope you enjoyed this talk today. If you'd like to learn more about my approach, you can visit my website at www.drrotamamir.com. The link is here. Would love to see some of you and help you reach a healthy weight. Thank you.